Okay, so here we have Andy. And Andy's been doing myofunctional therapy for almost a year. We're coming up on a year. And when I first met Andy, he had several things that we were discussing. One, he had his mouth open all the time, right, Andy? Your mouth was constantly open. Your tongue was constantly down.
Constantly.
And you had this tongue thrust, and we tested your tongue thrust with just saliva and also liquids and food, and your tongue was thrusting every time you swallowed. So we talked about how we might be able to fix some of those things and how that could translate to a healthier lifestyle and also a healthier face posture, and possibly even with the correct muscle placement, move your teeth into and guide them to a better, in your bones and your teeth, to a better position. So you had told me that you had braces twice. For the first time for 4 years at age 11.
Yes.
Tell me a little bit about that.
Once again, I remember the braces, and I remember my teeth getting to a certain spot where everything was pretty straight and killer, and then as soon as the braces came, after 4 years, as soon as the braces came off, I can remember my bottom teeth moving instantly, and then my upper teeth moving instantly. As soon as the retainer was gone, my teeth moved right back to where they were before.
Mm-hmm. Mm-hmm.
Rather quickly, too.
Yeah, okay.
So then I went on for 10 or so years, and then when I became a young adult, 25, I decided to give it another shot with another dentist.
Mm-hmm.
And it was pretty much the same exact process, except a shorter process, because my teeth moved back quicker. But as soon as the braces came off, I was like, if I didn't wear the retainer, once again, my teeth were just went right back to where they were.
Right.
So I didn't really understand. I didn't think braces worked.
Right.
Really, not for me. They didn't.
Right. Yeah. And we talked about why, because your tongue was constantly thrusting on your teeth,
I can
swallowing
remember all the way back to then.
Right, swallowing 500 to 1,000 times a day with that tongue exiting those teeth and pushing those teeth out, and then your lips staying open so nothing retaining your teeth in their position. So then when we talked about that, we also talked about how you have a history of clenching and that you were only touching on your back teeth because your tongue thrust had created an open bite.
Exactly.
And that you didn't really have a lot of control over your eating. And chewing and swallowing was
No,
just...
I didn't, but now that's, like you said, less than a year later, my tongue's on the spot when I swallow. I'd have to say 100% of the time, pretty much all the time. And then my sleeping has improved immensely with the no drooling and the mouth being closed and breathing through my nose. That right there was just an amazing gift.
Awesome. Good. I'm so happy for you. So you were drooling at night every night,
Yes.
and now that's gone. You're breathing through your nose. Your lips are sealed.
Yes.
Your tongue is up.
Definitely.
Your tongue thrust does not exist anymore.
No. Once again, I come in, I tell Jenae what I feel like I have improved on and what I need to improve on. She makes me the perfect weekly exercises to do. I do them for, let's say, 2, 3, 4 weeks, and then I come back and see her, and the improvements they're pretty much right away. Like every month there's a drastic improvement, and now that it's been almost a year, I'm totally amazed and just so glad that the myotherapy is in my life.
I'm so excited for you. You've had such great results, and I've loved working with you. Anything else you want to say?
Other than it's been an amazing experience, and you're the greatest teacher
Thank
that I
you.
could ask for too. I would have to just say, if you have any of these similar problems that I have, or you even just want to find out about myotherapy, I would contact Jenae, because this is an awesome thing that could help improve your life in a lot of areas. That's all I have to say.
Thank you, Andy. Thank you.
You're welcome.
I've loved working with you.
Awesome.